And now, it's my pleasure to welcome on board right here, Dr. Lee Khai Pin. Come on.
Hey, thanks, James. Thank you very much. Okay. Hi, good afternoon. My name is Khai Pin. For this afternoon, we're just going to talk about common childhood medical conditions as well as common childhood injuries. So I've titled the talk, Sticks and Stones May Break My Bones, but Parkway East will help me and help you. We are going to go through the few subheader topics. Sorry, today we are limited to just 20 minutes, so it is almost like a degustation menu. We're just going to go through each fairly quickly. But of course, please remember to send in your questions for the Q&A segment later. We'll be happy to answer them in slightly greater detail. Right, so fever. Now, everybody has had one. Many of our kids, unfortunately, do have one sometimes, and it is a topic of common interest. So we'll just start off with a poll first for this afternoon. The first question on the poll says, the higher the fever, the sicker is my child. Please feel free. It's a yes and no answer. You can only choose one. You cannot sit on the fence. The second question is, a prolonged fever in my child may be the sign of a serious illness. All right, we'll let the next few seconds.
Wow. The higher the fever, the sicker is my child. I would say yes, right? But you never know. I mean, if my kid is having a high fever, the higher it is, I'll be very concerned, right? So I'll think it's but that's me. What about you guys? What do you guys think? And the second question, a prolonged fever in my child may be the sign of a serious illness. Whoa. All right, the results are coming in. We have two questions. So, ladies and gentlemen, I'm going to give you the final 10 seconds for you to put your answers in. I wonder what the correct answer is. Ready? All right, and in 5, 4, 3, 2, 1. Let's see the results. Come on.
Okay.
Oh, wow. Okay. Question number 1 is half-half.
That's right.
Whoa.
It's exactly half-half. Okay, but we can do with more respondents later, right?
Right.
Because at this moment, it looks on my Instagram likes is it's not the highest. Yeah, that's fine. So the first question, the higher the fever, the sicker is my child. 50% says yes, 50% says no, so we're on the fence at the moment. The second question, a prolonged fever in my child may be the sign of a serious illness. 93% at this moment says yes.
Absolutely.
Right,
more of you believe is yes.
Go to the answers, shall we? Yeah. Okay. So in going back to the poll, essentially the higher the fever, the sicker is my child or your child. The answer is no, not necessarily. Because for even simple things like viral fevers, the temperature could go quite high, but it doesn't always mean that the child is sicker. That's the first thing. For the second part, a prolonged fever in my child may be the sign of a serious illness. Generally, we do not like prolonged fevers because the longer the fever, for example, 5 days, 7 days, or even more, it usually suggests that something deeper is happening. And in our local context, we are a lot more worried, for example, about bacterial infections than anything else. Yeah.
Well answered. Well, but I can understand why half of them said yes, half of them said no. Because if I'm thinking, I'm a parent, if my child's fever is 50 degrees, confirm, very sick right now.
How
50 degrees.
50 is,
confirm, very right now.
It's gone.
So I can understand why you guys are having this half-half answer here.
Right, thank you.
Thank you, Doc.
Thank you. I'm just going to go on to the slide. So fever, what, why, and who? As a lot of us would be aware, so fever is the body's response in terms of an infection, in terms of inflammation. And certainly, we know that there are multiple equipment or multiple instruments that are useful now for measuring temperature. So all the way from an ear temperature, which is tympanic, to a forehead, what I call a point and shoot, sometimes in the armpit, which is an axillary temperature. There's no need. Some of us are purists and we still insist on rectal temperature, but to be very fair and honest, a rectal temperature, for example, while it's the gold standard, it's no longer necessary in most cases that we see in the clinic. So that's one. Again, in referring back to the poll question, the higher the fever, the sicker is my child, and the answer is not always true, because in typical viral fevers, for example, influenza A, respiratory syncytial virus, the host of respiratory viruses, the fevers can sometimes peak at even 40 degrees Celsius, and the said child could be running around circles around you, running faster than the average adult in the household. So it is not entirely true that the peak of the fever will always reflect how serious the illness is. In fact, given that Singapore has good living conditions, good sanitation, good water supply, excellent nutrition, some of us, and good vaccination rates for childhood vaccinations, actually the vast majority of the illnesses that we encounter are viral in nature. There's obviously a segment that's bacterial in nature, and that is the job of the pediatrician, that's the job of the doctor, in figuring out which are the viral illnesses that will not require antibiotics because they cannot help with viral illness, and which are the illnesses that are bacterial in nature and will therefore require the course of antibiotics. Yeah, so I think that's something we want to look at. Yeah, I'm just going to go very quickly to what red flags or what are the things that we are worried about when your child or when my child has fever. So for babies or for infants younger than 3 months old, any temperature is worrying because we treat babies or infants under 3 months old in a special category of their own, and these babies are prone to serious bacterial infections. They are also more vulnerable because their immune system is not configured to meet the challenges of the world yet. So this is something that we'd like to look out for. For infants 3 months and older, okay, on the slide, we did put 40 degrees Celsius. I do understand that's not a temperature that every parent may be comfortable with. But again, look at how the child is behaving clinically. Look at how the child is reacting. Is the child still active? Is the child still eating well? Is the child still drinking well? So these are all the things that we want to look at in considering fever in a young child. If, unfortunately, there's been established fever, especially 3 days or more, I think some of us do self-medicate at home, especially for older children, teenagers, and even adults ourselves. We do self-medicate at home when we think that it's not so serious. However, if we do hit 3 days of established high fever, I think it's time to see a neighborhood GP, see your friendly pediatrician, just to make sure that things are going the way that they should be. At any point in time, drowsiness is not a good sign. Okay. To be fair, during a fever illness, it can be extremely difficult to tell, is the child sleepy, is the child drowsy, is the child just like adults, like we are doped out on medications for cough and runny nose. But if they are drowsy, especially if the fever has settled, that's not a good sign. If the child is lethargic and not interested in playing or engaging with parents, bad sign. And if there's any altered behavior and looking days, we believe parents very much. And when the parents tell us that my child is not his usual self, we usually take that very, very seriously because it is usually a sign of trouble, even though we can't pinpoint the exact problem, because that complaint itself is worth a lot. Any point in time when the child has poor oral intake, not drinking water, not drinking milk, that's bad. It's a reflection of that poor oral intake. The child also has poor urine output, very dry diapers, very little and yet very concentrated urine. Again, a sign of potential dehydration or dehydration itself. Any point in time, again, if the child has heavy, rapid breathing, looks breathless, or there's persistent, noisy breathing, I think that's a child that needs to be assessed. Again, the pale-looking child, any bruising or any bleeding. The last point about bruising and bleeding specifically addresses our local issues of dengue and dengue infection, because one of the things we obviously fear is dengue hemorrhagic fever, where the platelets drop and unfortunately the patient goes into a bleeding crisis. Yeah, from fever we move immediately into another common cause for concern, which is cough. Right. We have a poll, again, just 2 short questions. Hopefully we get more respondents this time. The first question is, I can easily tell if my child is breathless or wheezing. Again, it's a yes-no answer. The second question is, my child is wheezing. This means that he or she is suffering from asthma. Okay, let's see.
There you go. So guys, we need your response to make this very lively for us. All right, so if you're in front watching this, just type in your answer. It's just yes or no, right? I can easily tell if my child is breathless or wheezing. Wow. It's kind of tough, huh? But surely when there's wheezing, you can hear it, right? It's something blocking and everything. But I don't know. We're going to keep you guys in suspense. I'll let you know later. All right, here we go. Thank you very much for your response. I'm going to give you the next 15 seconds. All right, for those of you who have just seen this, our doctor is now asking a question. All right, it's a poll, just 2 questions. Question number 1, I can easily tell if my child is breathless or wheezing. Yes or no? Question number 2, my child is wheezing. This means that he or she is suffering from asthma. All right, final 3, 2, 1. Doctor, back to you.
Thank you, James.
Results.
Yeah. Okay, the results. 77% think or feel that they can easily tell if their child is breathless or wheezing. That's for the first question. For the second question, a large number feels that even if the child is wheezing, this does not mean that the child is suffering from asthma.
Seems about right.
Yeah, that's okay. Yeah, right. So those are the answers. So I can easily tell if my child is breathless or wheezing. I think the answer is no.
Huh?
I think the answer is no. To be fair, I agree. So in some cases, a patient, a child, or us, we can be audibly wheezing. So that's not difficult, but you could have circumstances where a child is wheezing, but unfortunately we can't pick it up without a stethoscope. Yeah, so that's one. There are signs to tell if sometimes the child is breathless, so how fast the breathing rate is, whether they're using other muscles, what we call accessory muscles, whether they're panting, how short a sentence they're speaking in, are they speaking in phrases. This obviously refers to patients who are already verbal. But there's some signs, but to be fair, I think breathlessness is not the easiest to tell. Breathlessness is not always the easiest to look out for. This is very different from fever, right? Because fever, everybody has like 1, if not 3 thermometers at home. They could measure and measure again. At a number, they could be prompted. So I think breathlessness is something we have to look out for. That's one. In the second scenario, I think most people agree that even if the child is wheezing, it doesn't always necessarily mean an asthma diagnosis because there are a lot of other conditions. So just to list off, there's bronchiolitis, there's bronchitis, there's recurrent viral wheeze of infancy. So a whole host of other conditions that could present with child wheezing, and that may not always mean asthma, which is very important, I understand, for insurance purposes because there's some labeling of that. Yeah,
Right.
but anyway. Yeah.
And there you go, guys. You see, the questions are never ever straightforward. All right, very, very tricky. Back to you, Doc.
Thank you very much. Let's move to the slide. So what and why and who is cough all about? Contrary to popular belief, right, cough is actually a protective reflex. Individuals who cannot cough for whatever reason actually end up in more trouble because we can't get the secretions outside of our lungs. So while we dislike cough because it can be disruptive to some of us, interestingly, cough is a protective mechanism. So it exists for a purpose. It protects the lungs, it protects the airways because it drives everything upwards and outwards. But why do we cough then? There are a variety of reasons, largely being infective. So a lot of us do cough because we have an ongoing acute respiratory infection, right? Some of us do cough because we are allergic or we are sensitized or we are sensitive to something. Be it in the air, could be dust, it could be dander, it could be a variety of things. So that's the second. There are some medications that can also cause cough, but largely not in children. But these are some of the common things that we look at now. So let's look at when is cough an issue, or when is coughing an issue. So number one, when there is heavy or rapid breathing. It's not the easiest to define, but what I usually want to share with parents is that if you carry your child, assuming your child can still be carried, and you put the child on your shoulder, with the child's head resting on your shoulder, which is a position that many fathers and mothers are comfortable with. When they're well, you can actually feel very nicely the movement of their chest against your own chest. You can feel that the breathing is gentle, you can feel that it's very gradual, and you can feel that the child is at peace or at calm. So during periods when they're having a bad cough, this is quite a useful maneuver because when you place the child in this position, you can therefore hopefully tell that the breathing is shallow. And the breathing is rapid because it moves very quickly against your own chest and it's not as deep or it's not as calm, it's not as gradual as it's supposed to be. So heavy or rapid breathing is something we want to look out for. In a verbal child, that means a child who can communicate, and that usually means above 18 months or above 24 months. Then they may complain that there's chest tightness, there's chest discomfort. If the child is not able to chat like her or her usual self, so usually very chatty, can speak like 20 words per second kind of thing, and then now can only speak in very, very short phrases or not speak at all, please be very careful. If there's persistent noisy breathing, persistent noisy breathing is difficult. In the home context, it is extremely difficult because as we breathe in and out, if you have a lot of secretions in our nose, in our mouth, actually the breathing may be noisy. So it's difficult to tell whether it's an upper tract noise versus it's from the lung or what we call lower tract noise. But in cases where you think that it's persisted for a second and the third day and the child is obviously not getting better, then that's the time to look for medical review. Again, with regards to the earlier segment on fever, if there are 5 days or more of prolonged fever, please be careful because this could mean a lower tract infection. For example, like a bronchitis, a pneumonia. If there is a lot of vomiting post-cough. So unfortunately, many young children can't spit. Spitting means you go to the sink, you bring up the phlegm, and you kind of do it away. A lot of them will unfortunately end up vomiting because that's the way of getting the phlegm out of the system. But because of this, they end up emptying their tummies as well. So whatever milk they've taken, whatever cereal, whatever porridge they've taken 15 minutes ago comes out together as well. So if there's a lot of repeated post-call vomiting involving large amount of feeds, then we do have to look out for the hydration status and possibly consider dehydration in the child. Again, a few points are repetitive from the earlier conversation on fever as well. So if there's poor oral intake, especially if there's poor urine output, if the child is drowsy or lethargic, if the sleep has been very, very disrupted, okay, unable to sleep at all because the poor patient is just coughing through the night, or woken up repeatedly by bouts of coughing. Any point in time, if the child is pale looking, if the lips and the tongue looks blue, those are fairly serious signs and should warrant an emergency response most of the time. Some of us have been diagnosed as asthma. Some of us are suspected for having asthma, but if they respond poorly to the bronchodilators, meaning puffs, despite regular 4-hourly dosing or as per the action plan, then this is also a cue to seek a medical review. Okay. Moving on very, very quickly to vomit, a single word, but I have a poll. Surprise, surprise. First question, my child is vomiting. This means that he or she is having a stomach/intestines or intestines issue. Number 2 is I should immediately offer my child a drink to rehydrate after he or she vomits.
Wow, Doc, these are very tricky questions.
But they are common questions.
Very common questions, yeah. Okay, again, all right, folks, 30 seconds for you. First question, my child is vomiting, right? Does this mean that he or she is having a stomach or intestines issue? Yeah, majority of you are saying no.
That's right.
And I can understand why. Because it could be a varied sources, right? I mean, the problems of your child vomiting could be due to many, many reasons. Question number 2, I should immediately offer my child a drink to rehydrate. Yeah, that's what I do. Right? I mean, everything's out. The throat is dry, there's acid in the mouth.
Right.
Give some water and drink.
Right.
Yeah, that's. I think every parent would do that, right? But is it yes or no? But knowing how this doctor asks questions, my yes will probably be a no.
No. I have to. Cannot work on intuition all the time. I have to see what is reasonable.
Yeah, the results are changing. You see. Yeah.
Okay. Yeah.
All right. Final 3, 2, 1, and here we go. The results.
Thank you. So for the first question, my child is vomiting. This means that he or she is having a stomach issue. I think 86% of the respondents said no, which means that they don't think it's just a stomach and intestines issue. For the second question, I should immediately offer my child a drink to rehydrate after the vomiting episode. 70% says no, and no. Yeah.
What?
No and no. That's
Why?
Right. Yeah. Let's explain. Vomiting is the worst single symptom in a child. It's the worst. That means if a child only has vomiting, be extremely careful because it covers all systems. When I say it covers all systems, what I mean is that it could be a brain concern and the child could vomit. It could be a visual problem and the patient, not just a child, could vomit. It could be a sense of balance in the ear and the patient could vomit. It could be a coughing issue, the child could vomit. It certainly can be a stomach or intestines issue, just like a viral gastroenteritis, and the child could vomit. It could be a surgical issue, the child could vomit, which also means that as a single symptom, right, unfortunately vomiting is the most non-specific symptom to have. But certainly, it doesn't always mean that it is a stomach intestines issue, so the answer is no. In the second part of the question, of the poll, I should immediately offer my child a drink to rehydrate. The answer is no, because, it is very comforting, right? It is very comforting. Oh, come, let me offer you some water, let's rinse your mouth. But unfortunately, at this moment in time, usually the stomach is still cramping away, the intestines are still feeling unwell. If you offer it immediately, there's an unfortunate chance that the same patient, the same child, could vomit again, and then you offer again, then vomit again, and we offer. That's how they clock up like 10 vomits in 3 minutes.
Oh, I'm sorry, kid. I didn't mean it.
Yeah, no,
I thought you were thirsty. I'm apologizing to my son now.
Yeah, I'm
One
so
day you're
sorry.
vomiting 3 times in a row.
I'm not insinuating anything, yeah.
But how soon then?
I think generally we would say wait for about 15 to 30 minutes.
Oh, there you go.
Depending on what we thought the cause of the vomit was. Yeah.
Thank you, Doc.
Thank you very much. Thank you. I will move on in the interest of time. Again, what, why, and who. Okay, so vomiting, if taken into usual statistical context, right, then to be fair, the vast majority, thankfully, will be a viral case. For example, what's commonly called stomach flu. We call it viral gastritis or viral gastroenteritis, but essentially that's something we look out for. Tummy is not feeling well, intestines not feeling well, so everything is just coming out from the way, from the mouth, right? When is that a problem, right? So if there's recurrent vomiting, that means no matter how much you have tried, no matter how long you have waited, your child is unable to tolerate even small amounts of water or fluids. Vomitus that's green in color is bad unless you think the child has taken something green before, but otherwise it's bad because it sometimes suggests a blockage in the intestines and everything is flowing upwards. If there's blood in the vomitus, not always bad, but certainly worrying and will require a medical assessment just to figure out what's happening. Again, some repeats from the earlier slides: poor oral intake, even fluids, poor urine output. If there's worsening abdominal pain, that means the tummy is painful and it's located at a very specific site. Please be careful because certainly for example, that's how appendicitis may sometimes present. If there's prolonged fever, 5 days or more, if there is a lot of profuse losses in the diarrhea or in the stool, if there's blood in the stools, if the child is drowsy, the child is lethargic, or if it's outside behavior. So again, you see these common threats happening, but these are again when we look out for the child as a whole and not just as a symptom, and we want to assess the child as a whole. Okay. Injuries is a fairly large topic. I shall try to cover it as much as I can because, after all, the talk is entitled "Stick and Bones May Break My Bones," but Parkway East will help you. Yeah. So head injuries, lacerations, limb injuries, scald and burn injuries. Let's go. Very quick poll. We're just going to limit this to 30 seconds. First question is: knowing how exactly my child was injured is important to my understanding of his or her injury. Number 2, sprains are common in toddlers after a fall. Number 3, head injuries are very common and harmless. Okay, so we'll just let it run a little bit. Okay, thank you very much. Yeah.
Right, final 5 seconds in the interest of time. 5, 4, 3, 2, 1. Thank you, guys.
Great, thank you. So first question, everybody thinks, yep, absolutely. So sorry, the answers. For better or worse, a lot of parents have CCTVs at home now, which means that it works in this context because we have seen injuries where you hear a sound, you go into the living room, you have no idea how the child fell. But because there's a little camera that was monitoring, they play back the CCTV clip. Actually, we can actually tell now. It helps in that sense. I'm not sure about Big Brother watching, but for this particular situation, it helps because we know exactly the mechanisms, and that helps us prognosticate how bad the injury was or is. Unfortunately, toddlers don't sprain after a fall. If they do have limb pain after a fall, if your toddler is under the age of 5, I'm really sorry, then it's more likely a fracture than a sprain because they fracture more easily than they sprain. Number 3, head injuries are indeed common, but they are not always harmless, and therefore it may warrant medical review and assessment to make sure that your child is okay. Right, again, what, why, and who. I'll go quickly because there are separate categories. The first is head injuries, when to seek help. Okay, if there's a fall from height, but what does fall from height mean? So usually we determine that if your child unfortunately fell from a platform that's raised, that is 3 times your child's height or length, then that's worrying. Okay, so we define as that, and that's something to look out for. If you think at any point in time your child lost consciousness, that's worrying. If there's inconsolable crying after the episode, if there's recurrent unprovoked vomiting, persistent dizziness, or worsening headache, because all these signs potentially point at a brain, or what we call an intracranial injury. So again, inconsolable crying, unprovoked vomiting, dizziness, headache, and unable to walk in the absence of limb injuries. So all these are potentially brain injuries, not just a skull injury, and these are things to look out for. Again, if after the head injury there's weakness in one or more limbs, the child has blurred vision, slurred speech, if there's unfortunately blood or fluid flowing from the nose or the ears, if there are large and deep puncture wounds on the face, if the child is drowsy again or child's dazed looking, again, all these look like a nightmare. Actually, if today's filming was for Halloween, it's more appropriate. But anyway, all these are bad things to look out for, not good. Halloween's over, everybody should look clean and non-bloody. Right. If there's a huge laceration or wound on the limb, then when do we worry? Okay. If there's persistent vomiting, sorry, I beg your pardon. If there's persistent bleeding, even after you've applied direct pressure, that's not great. If there's a deep puncture wound, okay, we are worried about puncture wounds because we actually don't know how deep the wound has gone, because we can't see the depth of it. Right. And seeing how the base of the wound is very, very important because it allows us, for example, in gaping wounds to make sure that there are no underlying tissues, tendons, important structures like blood vessels that were cut in the process. Wounds near or involving eyes, ears, nose, mouth, and neck are worrying because very important structures, very important for our senses. If there's a limb wound, meaning to get a cut, unfortunately, on the leg or on the hand, and it affects function. That means you can't bend the elbow, you can't flex or extend the fingers. Not great, must be seen immediately. Okay, if the wounds are heavily contaminated, please be very, very careful. because we also need to look at things like antibiotic coverage. We need to look at anti-tetanus treatments. These are important apart from just cleaning and suturing up the wound. Animal bites, in fact, human bites are also classified in the same category. So animal bites / human bites or claw injuries are very, very contaminated, and therefore any of these bites should warrant a review. There's worsening of pain in injured areas, and pus are discharged from injured areas. For limb injuries, if the bone is exposed, most people would seek help. If there's a deformity of the bone or joint, if there's increase in swelling of a joint, there's worsening limb pain, especially on movement or touch. Your child wouldn't allow you to touch the limb after he has fallen down or she has fallen down on it. If you cannot get the child to stand even briefly on the affected lower limb, and again, if the wounds affect the function, that's something that we'll be worried about. And move on very, very quickly to scald and burn injuries. Okay, the first important point is actually all scald and burn injuries are highly preventable in our context. It's highly preventable. So it's always quite sad when it happens, but in case it happens, if there's blistering with affected skin peeling off, there's large area of involvement. So basically, if you look at your own palm size, right? So the palm plus the hand, this is about 1% of our own body surface area. So if anything more than that, and you have to look at your child's palm size, so you cannot use your own palm size because this is 1% for me. So if I use it for a child, that's 1% of the child. So the child's palm size is 1% of the body surface area. If anything more than that is affected, should see somebody. If the burn or scald involves the face, the neck, the hands, the feet, or genitalia, because these are important and sensitive areas, there's persistent fever after the scald or the burn, there's worsening of pain, and there's pus discharge. Okay? The very last part is, unfortunately, if the child was trapped in a room that caught fire. While fires, again, are not common, inverted commas, in our context, you know that recently with charging of PMDs of equipment, we have had a few more unnecessary fires. Any fire is additional and unnecessary. But if the child was unfortunately trapped in the room which caught fire, then any of these signs listed below point at possible complication from that trap. So one, hoarse voice. If you see soot, black substance in the nostrils or the throat, if the eyebrows are singed already, or the child is drowsy, because these are all important factors to look out for in case the child has been poisoned, inverted commas, by being trapped in the burning room. I have come to the end. I'm sorry I've exceeded the timing a little bit, but thank you very much. We'll see you again during the Q&A session. I'll hand the floor back to James. Thank you very much.
Oh, thank you, Dr. Lee. What a brilliant man. What a brilliant, brilliant man.